To truly understand where we are today in the realm of mental health, we must look back at its origins. For centuries, mental illness was misunderstood, often attributed to supernatural forces or seen as moral failings. It wasn't until the late 19th century that mental health began to be examined through a scientific lens. Pioneers like Sigmund Freud, often referred to as the father of psychoanalysis, began to explore the human mind in unprecedented ways. Freud's work, while controversial, opened the door to further study. Meanwhile, in Germany, Emil Kraepelin focused on classifying mental disorders, laying the groundwork for modern psychiatry. These early efforts marked the beginning of mental health as we know it today. However, it was not until the mid-20th century that mental health issues were given the global attention they deserved. The invention of psychotropic drugs like lithium for mood stabilization and chlorpromazine for schizophrenia revolutionized the field, leading to the deinstitutionalization movement and a new era in mental health care. As mental health awareness expanded in the 20th century, technology was poised to become both an enabler and disruptor of mental well-being. Fast forward to the 21st century, and technology is everywhere. It's an integral part of our daily lives, from smartphones to social media, digital entertainment, and the 24/7 news cycle. But as our digital footprint grew, so too did concerns about how these innovations might impact our mental health. Research shows that prolonged screen time, especially on social media, has been linked to heightened feelings of anxiety, depression, and loneliness. The constant bombardment of information can overwhelm our cognitive capacities, and the curated nature of social media often leads to unrealistic comparisons, breeding feelings of inadequacy. For young people who have grown up in the age of Instagram, TikTok, and Snapchat, the impact is particularly pronounced. A study conducted in 2022 found that nearly 20% of teenagers report experiencing symptoms of depression related to their social media use. Yet, in the same digital ecosystem that fuels anxiety and stress, technology is also emerging as a lifeline for those struggling with mental health. Apps and digital platforms are redefining how we think about mental health care, providing accessible, affordable, and often anonymous ways to seek help. Mobile mental health applications such as Calm, Headspace, and BetterHelp have become household names. These apps offer everything from guided meditation to cognitive behavioral therapy techniques, all at the touch of a button. For those who live in remote areas or have limited access to traditional mental health care, these tools are a game changer. AI-driven chatbots like Wobot provide real-time mental health support, offering cognitive behavioral therapy, CBT, to users around the clock. Unlike traditional therapy, AI solutions are always available, providing immediate feedback in moments of crisis. Additionally, wearables such as the Apple Watch or Fitbit can track not just physical health, but also mental well-being, monitoring indicators such as heart rate variability and sleep patterns, both of which are closely tied to emotional states. However, the rise of digital mental health tools comes with a caveat: data privacy. As millions of users entrust their mental health data to apps and platforms, questions about who controls this sensitive information are more urgent than ever. In 2024, privacy concerns have reached new heights, especially with the increasing number of data breaches and the controversial use of personal data for targeted advertising. Ethical concerns also arise when discussing the potential over-reliance on these digital solutions. While mental health apps and chatbots provide immediate relief, they are not a replacement for traditional face-to-face therapy, and there's the risk of creating a generation that seeks digital quick fixes for complex emotional problems. The legal landscape surrounding mental health has evolved significantly over the past few decades. In the US, the Mental Health Parity and Addiction Equity Act of 2008 was a watershed moment, requiring health insurance plans to offer the same level of benefits for mental health care as they do for physical health care. Globally, organizations like the United Nations and World Health Organization have prioritized mental health as an essential component of public health. In 2024, mental health is increasingly seen as a public policy priority. Countries around the world are implementing mental health strategies that leverage technology, recognizing that digital solutions can bridge gaps in access, particularly in underserved populations. Technology, however, is also becoming more sophisticated. Virtual reality, VR, is now being used to treat conditions like PTSD and anxiety through immersive exposure therapy, while biofeedback tools allow users to monitor their mental states in real time, creating personalized strategies for managing stress. As we continue to integrate technology into our lives, the relationship between mental health and digital tools will remain complex. It is clear that technology has the power to both harm and heal, and finding the right balance is crucial. As we embrace the benefits of digital mental health tools, we must also remain vigilant about the potential risks, particularly when it comes to privacy and the quality of care. In the future, our ability to strike this balance will determine whether technology becomes a true ally in the fight for mental well-being or a contributor to its decline. Join us for another insightful episode on Thursday. Thank you for watching.